right, let's call the meeting to order. We're at 10 o'clock. And I see that we have 7 of us. David is missing.
Dave's brother passed away last week, so he is out of state.
Yeah, okay. So we have Art and Janine and me, Prudence, Ruth, and Sheila, and looks like Julie's on, but can't see her yet. And our guests are Marcia and Michelle, and we will have a Meals on Wheels presentation. So welcome back to Zoom. Hopefully it's not forever. It doesn't look like we have any public person, so we can take a look. And have you gone over the October minutes, and are there any questions, corrections about that? Yes, Sheila.
My last name is Conroy, not McCoy.
Really? Did you change your name?
Well, I was hoping nobody would notice. Oh my goodness.
Got married again or something, you know.
A likely story.
All right, so if Prudence would correct that, I guess we can. Yes, Janine.
I had a question. I wasn't sure in the minutes, and I wasn't really sure. Sheila, were you going to assume the board for economic development? We talked last week. Dave was going to volunteered. Pardon?
I said I may have volunteered, but I don't recall.
It wasn't specific in there, and I actually called them to make sure that, you know, you got a notification of meeting, and I called them 3 times actually and did not hear back from them. So I know you didn't get a request for the meeting, but neither did I. So that's something we have to continue to work on. I'm not sure what they're doing. They were meeting quarterly, but they were supposed to meet last month, and I heard nothing from them. So I'm not sure what's going on there, but I'm willing to continue to pursue, perhaps even stop by to their place and see if I can talk to a personal face.
Okay, and just let me know how you get on.
Michelle?
Okay.
Yeah, and I did those minutes. So I will make the correction. I did the October minutes because Prudence was out. So I will make the correction. Sheila, I apologize for.
That's fine.
I must have been thinking about who was running for the election yesterday, right? Maybe Marcia has an update, but I'll make that correction.
Thank you. Do I hear a motion to accept the minutes as amended?
Yes.
Sheila, seconded by Art. And I don't see Carla on board yet. Is she due in shortly? Should we go over all business?
I believe it's Katie who is coming. So
Okay.
yeah, so let me do a couple checks and see what's going on.
Okay. Did you want to then take care of old business, Michelle? You're muted.
Sorry, I was trying to track down Katie.
Okay.
So I am ready for if there is a board member who would like to help out and review the foot care RFPs. We're going to go ahead and release them. We're going to give about 3 weeks to 4 weeks. So it would be the last week of the month, first week of December. If there is someone who is interested in reviewing the proposals that come in through the foot care RFP. So
I'd be happy to do that.
Sheila and Janine are interested. Okay. All right. So what'll happen is when those come in, we will probably make copies for you all. Their city is very, very, very particular. We call it the cone of silence. So once you get those proposals, you're not allowed to talk to anybody about anything related. And so the purchasing staff will go over that with anyone who's reviewing those proposals. So I'm not sure if they're doing that in person or virtual, but there is a pretty strict formality to that process. So Janine and Sheila, thanks, and I'll be in touch with you about that. So that is moving forward. Oh, am I up next? Okay.
Position updates,
Position update.
positions.
Positions as in plural, right? So
Yes.
I reopened the custodial position because Art may want to add two, but we only had 2 interviews that we did. So I reopened the position. I have 2 new applicants. And I'd like to try to set up some interviews for this Friday, Art, if you have some time, or anyone else. If Art's not available, I was thinking of Art because he did the prior 2 interviews. That's this Friday afternoon, Art, if you're available. And as I said, if he's not, and in addition, if somebody would like to be a part of that.
Michelle, can you tell me the salary range?
It starts at $17.16 an hour. So yes, you can make more money working at McDonald's.
Right.
Not better benefits, but more per hour.
Michelle, what time are you planning on doing that? I do have an appointment at 4 o'clock that afternoon.
I am looking at probably 2:30 and we could be done by 4. Those interviews took about 30 minutes. So 2:30.
Sure, I can make
Okay.
it. You can make it any earlier, that'd be fine, but if 2:30 is fine.
Okay. All right. So we'll do those. And then Deanne, the part-time office assistant position, we are looking at doing interviews the 12th and the 16th. Is there anybody who's interested in being a part of the office assistant interviews?
Right now, that's
Ruth? Ruth, you're available? That would be great. Either day, a better day for you?
Well, let me check. Probably 12th and 16th.
Yes, ma'am.
12th is open. 16th is open.
Great.
As long
So
as
right
it's not
now, I'm
evening.
thinking we had 10, right now we have 10 applicants for that position. And so we'll go forward with Robin and Monica and I are reviewing applications to decide who to interview, and we'll get back with you as quickly as we can when those get scheduled.
And Michelle, I'm also open those 2 days at the moment. So if you need some help or a backup, let me
Okay.
know.
Great. Super. All right. I think I see Katie's on, so I can quit there unless there's any questions.
You can take a break. Welcome, Katie.
Hello. Hi.
Are you not going to share your face on camera?
Let me see if I can fix that. Maybe. There we go.
There
Hello.
you are. Thanks for coming, and we're looking forward to your presentation.
Thank you for having me. I apologize. This is a late start morning at school and I completely forgot about that. And so there is a 6-year-old wandering around. Be prepared. She's doing her best to entertain herself, but yes. So the kind of the biggest highlights of what's going on right now are that we are back to serving community meals in person, but on a very limited basis. We have the seats very far apart in the Parkview Cafe, but people are also encouraged, if they prefer, that they can take their meal to go with them. But we really wanted to supplement that senior center program. We've had a number of people throughout the summer months who have stopped by the senior center for something, who might just have a little bit of time between programming for lunch. And so we really wanted to make sure that those folks could still get a meal. It's not getting a huge turnout, and that's okay. That's probably a good thing right now. We're getting 5 to 15 people per day, but like I said, probably the priority is more supporting the senior center and not necessarily drawing people out right now who are coming just for lunch and nothing else. But yes, you may go get an orange, sorry. But some people are taking it to go. We've noticed in the nicer months, some people would take it with a friend and go sit outside with it. And so that was lovely to see. We're back to delivering 5 days a week. We always were, even during the worst of the lockdown, we're always sending out 5 days of meals per week. We were just doing it in varying, amounts of delivery days, but we're back to delivering 5 days a week. And that's wonderful. That's really ensuring that we are having constant contact with, those vulnerable folks in the community, and making sure that we have eyes and ears on them, and that they're getting everything they need, and we can have those daily wellness checks and report back to senior services if something has changed in anybody's status. So we're really glad to kind of be back to that. Our volunteers, a lot of our volunteers had taken off completely until we had returned to Tuesday, Thursday. And of course, as you know, a lot of our volunteers are older as well. So it's nice to be able to have a full breadth of those folks back. Our numbers are still a little bit lower per day, but that's probably just because of those community lunch still being lower. And like I said, we don't want to go full blast on that yet. We just want it to be supportive of the senior center right now. Does anybody have any questions? Yes.
Katie, a couple questions. So how many home delivery meals a day are you averaging? Because it seems like you were up to about 500 as the pandemic unfolded. Where are you now?
Probably about 450 per day right now, plus then, a handful that are coming to the senior center. And of course, we're still sending out frozen meals for people for evenings and weekends. So in total, it's probably right now about 460 to 475.
So Katie, I'm not sure that all the board know who you are and the position you hold. And I wonder if you would just do a brief little snip on Project Homecoming.
Oh, of course. Okay. So I am Katie, and I am in development and communications for Longmont Meals on Wheels. And I'm coming up on my 10-year anniversary in February. So I've been there a while now. And yes, Project Homecoming. Project Homecoming is a wonderful project that we love for a lot of reasons. What it is we offer 5 free meals to anybody coming home from the hospital, an outpatient treatment, dental surgery, a rehab facility, 5 free meals to anybody in the community. This is not just older people and people with disabilities. This is anybody. It's, most people, something like 60% of people do not have a plan for meals when they are discharged from the hospital. So that was the first need we were trying to meet. But what has come along over the years is that we have discovered that it has been a wonderful outreach tool for older adults. So many older people say things like, somebody needs that more than I do, or I won't like that food, or, you know, what, or the big thing is somebody needs that more than I do, is that we hear. And so this is a very open, safe way to try our program, to try our meals. And we find that more than half of older people end up staying past their 5 days. And then what we do is we can slide them into our sliding scale wherever they belong financially, and we can keep them on the program then, whether they still just need it just as they're recovering from whatever it was that they were recovering for, or if they want to stay on it longer, just as they're aging.
Katie?
Yes.
So if somebody's introduced through Project Homecoming, and whether they stay on a week or two longer, but say they go off and a year later they have another situation, is that Project Homecoming once in a lifetime or once per medical issue?
Once per medical issue. Actually, once per hospitalization, once per inpatient or outpatient treatment. You basically, if you're seen intensively, more than just kind of routine physicals, if you're seen intensely by any medical professional, come on back.
Thank you. And Ruth?
What's the sliding fee schedule? And where does this
So
go?
we say that we go from 50 cents up to $5.50, but I think last year around 40% of our clients didn't pay anything. So we like people to pay something, just because it helps them remember to get their meal and let us know if they don't need it that day. But we accommodate anybody. So we don't want finances to be the reason why they're not getting the nutrition or the wellness check that they need.
Is that the home delivery sliding scale?
The sliding scale in the senior center is almost the same. The only difference is it goes up to $6 for guests that are under 55. But it for people over 55, it's the same sliding scale. If you're under 55, we'll go to the full $6.
Julie?
So I just want to make sure I understand that the hospital, the 5 days. Did you say is that for people who are 55 and older?
It's for anybody. Anybody. Yes. And we actually partner with Boulder County. I don't know exactly their name, but the youth and family division of Boulder County for their Project Genesis. And so we will feed, teen moms, young moms coming home from after delivering. But its intention, Marie, you gotta give me a little time, honey. But its intention is, people with chronic health issues, long-term health issues, disabilities, and older people. But yes, we make it open to anybody so that it is an easy introduction to our program. So there's no stigma attached to it. We don't want people to think of us as, industrialized food. And so this is an easy way to just give us a try.
And Katie, how does somebody sign up for that? I'm thinking if I had another hip surgery and I thought this would be a good idea, who would I call?
So you can just call anybody in our office, call our direct number. We have an enrollment form to kind of get you started online on our website. It just gets you started. We still going to have to call you and check in with you. But social workers and case managers, caregivers, especially for Project Homecoming, will give us a call and sometimes set it up on behalf of their person.
Give us that phone number, please.
I'm sorry?
Can you give us that phone number, please?
Sure. It's 303-772-0540.
Thank you.
And Katie, for people over 55, do you keep all that initial enrollment information on hand? So if they come back a year or two later, you have that?
Yes.
Nice.
But we certainly still do kind of a re-enrollment. We still will want to check in and make sure that all of that information is still correct, but also see if there's anything else going on.
And Katie, I've been delivering meals for close to 2 years now, and it's always been the same route. So most of the people I see once a week for 2 years, and they really appreciate it. I mean, people
Well,
that
Sheila, it's nice to meet you. I can't believe I've never met you. What day of the week are you?
Monday at 11:30.
Okay, that's really weird. I was there Mondays all summer because I was covering Megan's maternity leave. I'm so sorry that I've never met you.
That's
But
quite all
yeah,
right.
She had her mask on.
that's true. But
Yes.
Sheila, thank you for raising that point. We do try to keep people on the same route every week. Certainly, we want to hear back if somebody isn't answering their door and they don't have ice in their cooler. We offer people a cooler with an ice pack, which indicates to us that they're well, but they had to step out for a doctor's appointment, or they had something that they knew they weren't going to be there, but they're okay. So we don't have to do a follow-up check on them. But we also, and then if we hear back from a volunteer that that person hasn't arrived, we don't leave for the day until we either know where they are or we can pass along our concerns to their emergency contact person. But in having the same volunteer on the same route every week, people like Sheila can also just be like, so-and-so just wasn't acting herself today. Something's different. She seems worse than usual. This wasn't her. And we can call the client and kind of see for ourselves, maybe drive out there ourselves and see, and then work with their emergency contacts to see, again, if we need to refer them to senior services or if we need to get medical professionals involved.
Yes, I have had to call a few times when somebody who's always there or always has their the cooler out, there's nobody there.
Right.
And once somebody still had their previous day's meals in the cooler. So
yes.
luckily there wasn't a serious emergency.
Yes.
So it's useful.
I have a question, Catherine. There are some obviously that don't have computers, electronics, things like this. If they call in and they need a form, and you said they have to complete a form.
No, it's just one of the options.
Oh, one of the options. Okay.
Yeah, we're just available 2 ways. Sometimes a caregiver will get the ball rolling, get everything started, and they prefer to start online. Or sometimes people do have technology and will want to get the process started online. But it always finishes, no matter what, with a phone call. It can start with a phone call though too.
Okay.
Prudence.
Hi, Katie, thanks for coming, but I have a question. Do you also do specialized meals? That was the first question. And then the second question is that do you do satisfaction surveys?
Okay, yes, we can accommodate special diets, although right now we are asking most, but not all of our clients to manage their special diets on their own. And the way they do that is we do publish the monthly menu in advance, and they need to look it over. And if there is a day that it doesn't meet their dietary needs, they can call us ahead of time and say, I need to cancel that day, but can you send me 2 meals on this day? And so that they can make sure that they always have a meal for every day, but they are managing. Now, for our clients who have cognition issues, we have, we're, like everybody, just because the staff role is more intensive still, even though we are back to delivering 5 days a week, staff role is more intensive than pre-pandemic. And so we're trying to make it a little bit easier on staff so that we can still maintain the level of service and the cost. And so for the longest time, we were having everybody do that, but we have had to step back in for people with cognition issues and help them manage their diet. But for people who are looking for preferences and are mentally able, we're asking them to manage their special diet needs right now. And yes, we do send out client satisfaction surveys every February.
And is that information then shared with the senior center?
No, but it can be. I share that with a number of funders, and I'm happy to email that to Michelle when I get offline here.
Yeah, if everybody else is interested, I don't want to just make it my own interest.
No,
That would be interesting. Yeah. Ruth, you had a question?
I would be interested as well.
Sure.
interested to see.
And we do encourage a participation by, I think we offer one free meal if we get a return survey.
Little incentive.
Yes.
Ruth?
How are the nutrition levels set?
So we follow guidelines for sodium. I forget what that current guideline is. It is on our website. I can pull it up real quick. But we also do not send out desserts except on holidays. We don't send out a bread anymore. We used to, but we stopped that. We have too many clients who are on low sodium and low sugar diets anyway. And it was becoming, and again, that was pre-pandemic, but it was becoming where almost everybody was on a special diet as a result. And most of our clients were, you know, the primary modification was that they weren't getting bread and dessert anyway. So we went ahead and just changed that. And we made it so that we're not doing that anymore. Of course, we still do for holidays. We want to make holidays special because it is especially a time that can be isolating for older people on the holidays. We also then can accommodate, you know, community diets and a number of other medical diets. We can also do soft diets for people who need soft diets. Yeah, those are the big ones. And then we also want to make sure that we're offering a diversity of meals as well. We certainly don't repeat a meal within a 30-day period. There are some meals that are very popular that we do repeat once a month, but we try to offer a variety that doesn't repeat too much for 3 months. We try to kind of mix it up with ethnicities as well. Oh, and here it is. We never, all of our meals are under 16 milligrams of sodium, but most are under 1,000 milligrams. It sounds like the levels were just adjusted by dietary guidance in sodium. And we're looking at that to see if that's something that is going to become a permanent recommendation, or if that was just kind of, you know, how peer reviewed it was. I mean, sometimes you'll hear pup news versus peer reviewed articles. And so we have been kind of looking into that again with nutritionists lately.
Michelle, did you have a question before?
Did anybody else have their hand up? I don't want to jump in, but I was going to ask Katie to speak to the funding just a little bit. And for some of our new board members, the Area Agency on Aging, Boulder County, does get funding, federal funding for nutrition. And Longmont Meals on Wheels and Boulder Meals on Wheels do not receive those federal dollars, and Katie can speak to that. But to Ruth's question about requirements, one of the advantages of not getting the federal dollars is you can meet dietary requirements without reading some of the very, very strict federal nutrition requirements. So Katie, maybe just a quick kind of where you get your funding and what that's like.
Sure. Yeah. Thank you, Michelle. I'm glad you brought that up. And strict is not even quite the right word for it. For example, if you get, it's kind of beyond strict. If you get a last minute donation of, say, green beans from a local farmer and they're fresh and you need to use them tomorrow, you would have to run that up the chain of command to get that approved. You can't just swap it out for corn, for example, without pre-approval. And also no more or less than 4 ounces of meat per day. If you get caught serving more, you can get dinged. So it's very, very strange restrictions. It's all under the Older Americans Act, which hasn't been updated since the late 60s, early 70s. And so it's kind of very old fashioned. The Hour Center doesn't, you know, sometimes people like to compare us to the Hour Center because we're both serving a lunchtime meal. They don't have the same guidelines. They don't even need to be in a professional kitchen, whereas people under the Older Americans Act do. And so it's very different. Now we are in a professional kitchen because it's very important to us, but Yeah, so that's one of the restrictions. Then there are other restrictions about who you can serve. There's also less privacy. We did do 1 month where we got a little support from the local AAA during the pandemic because they rolled back the Older American Act requirements, and the amount of things that they initially asked us for was some of our, we would basically have to go back to our clients and get approval to give them that level of information on our clients. And so we managed to kind of get the bare minimum just for 1 month of funding during the pandemic. But yeah, it's a very old-fashioned legislation, and it just isn't very applicable to our community. And especially if there are folks where privacy matters are concerned and they don't like the federal government necessarily knowing everything about them. There are other Meals on Wheels around who will sometimes actually run 2 programs at the same time, one that gets federal funded and one that doesn't. The system for the federal funding is very expensive, and again, collects all the data and has to send it off and report it monthly to get any kind of funding. It's just a very weird, strange way of doing a program. And what we have found is most of our clients in the community don't like it. They don't want to share that level of information. It can be an impediment if you ask too many questions up front about somebody to them starting services. We don't want to do that, especially in our community meal. We make sure that people can just walk in the door and they just sign in the sign-in sheet. They don't have to give any information. And it would take all of that away. Our community just wouldn't, we still don't get the sense that our community would be behind it. Plus, we live in a very supportive community. And so we've never had to really seriously consider it, at least not in my time. I know a couple decades ago, there were some tighter times and the previous executive director had to kind of make some considerations like that. But as long as we continue to live in such a supportive community, it doesn't have to be on the table here, something we even consider.
Janine?
That came up at Boulder County Area on Agency meeting, and they strongly support your decision.
Oh, do they?
Yes.
Well, that's nice to know. And I know that they also would love to see the Older Americans Act changed.
Right.
Yes.
But they totally understand the red tape and that it's not worth the hassle, and that Meals on Wheels does a far better job on their own. So
Right.
Just so that you know that.
Well, that's nice. Thank you for that feedback, Janine. I appreciate that.
2 things, Katie. Number 1, would you go over how your grocery shopping can benefit Meals on Wheels? At least at King Soopers.
Yes.
And number 2,
Exactly.
the Lockbox Program.
Yes.
So shopping in the Lockbox.
Yes, King Soopers has changed their rewards program. It used to be that it used to have a very cumbersome process where you had to buy gift cards through the organization you supported, and then use them. And we never did that. It was very cumbersome and very complicated. So now we do have a link on our website if you're interested. It's under the Give tab of our website, which is longmontmeals.org. And if you just Google King Soopers Community Rewards and you sign in, you just search for Longmont Meals on Wheels, and what you can do is your regular, what do they call that? Your loyalty number, when you either scan your card or you use your phone number, you can have your number linked to your favorite nonprofit. And then a portion of everything you buy, King Soopers will donate on your behalf to us. And I think the last quarterly report I got, we have 65 households signed up for that. And we get about $1,500 a month from that. And I haven't done a push for it. We would like to see more than 65 households. But yeah, it's wonderful. And then the same thing with Amazon Smile. If any of you use Amazon, you can use smile.amazon.com instead of amazon.com. And it's the exact same Amazon. But again, you link your account to your favorite nonprofit, and then they will donate a portion. I think that's 0.5% of all your purchases then will go to whatever charity you link yourself to. Yes, Prudence.
I'm not sure whether this is a question for Katie or Michelle. So there was federal money distributed I believe, to the Boulder County area on aging through the pandemic response.
Mhm.
There's Meal on Wheels, because I understand what you're saying in terms of the federal guidelines. So will Meal on Wheels get any of that money or no?
So we did. I did receive an email a couple months ago that they had some more money and they were trying to see what they can do. But the only way it worked was because all of those very strict strings on the Older Americans Act were rolled very far back during the pandemic. And so then, yes, we did, I think it was 1 month. They supplemented 1 month of our clients during the pandemic. And then, like I said, I did get an email that they were looking to see what else they could do, but it really is very dependent on how far back the restrictions of the Older Americans Act is.
Okay, thank you. I just was curious.
No
Because I know
problem.
Boulder County got a lot of money.
Yes, we did too. We got one month for all of our clients who were older than 50. No, I think older than 58, maybe older than 60. But yeah, we had to come up with a couple compromises. But it all worked. It all worked. Yeah. And then Susan, you also asked about the Lockbox program. Was that right?
Yes, I did.
Yes. Okay. So we have a Lockbox program, and it came about like a lot of things do, very tragically. But at the end of 2014, beginning of 2015, our city attorneys decided that they needed to change how emergency services wellness checks were done. So these are not our wellness checks that we do every day. These are when we need to call 911 because we have concerns about the well-being of a client and we're just asking for an emergency check. So the city of Longmont attorneys decided that they needed to be erring on extra caution and extra privacy rights. And like sometimes that happens when we kind of think about the privacy of the general population, it rolls back the safety of vulnerable populations. And that's exactly what happened. And during that time, we had about 4 clients that we suspected had fallen and we couldn't get to them. And we couldn't get emergency services to do anything without probable cause. And probable cause is not newspapers piling up. It's not meals piling up. It's not the TV blaring at all hours of the day. And it basically was hearing somebody calling for help or missed payments, things like that. And they decided that emergency services could no longer see if a door was unlocked. They could no longer look through windows. They could no longer walk around the perimeter of a house. So it was a very scary time. So we came up with a lockbox program where a local realtor donated the lockboxes and we get signed consents from our clients. Longmont Fire then, this was a really hard time for Longmont Fire too. And so they were very supportive of this program, and it was the fastest they ever kind of started to partner very intensely with a nonprofit because this was a really hard time for them as well. And they were looking for a solution like this too. And so they will go out and they will put the lockbox on a client's home. They will also, while they're there, they'll walk around and check fire detectors, carbon monoxide detectors, all that kind of good stuff. Loose cords, fall risks, those kinds of things while they're there. So it's a good check-in with them anyway as well. And then they store the code in their secure CAD system. And then anytime we call for a wellness check and we need an emergency assistance to check on somebody, we call non-emergency dispatch and we ask for fire, and they will meet us out there. Then fire can use it when we're not in the office as well. So if a neighbor calls, if a neighbor calls for an emergency wellness check, or if a client calls but can't come to get to the door and their door is locked, fire now doesn't have to break down doors because it's always a liability for the fire department to come and use an axe on your door. And so this ensures then that there is a lockbox available and you have signed a consent. We've since expanded the program as well. It's open to anybody in Longmont over the age of, I think, 65. You don't have to be a client of Longmont Meals on Wheels, although we really encourage it because, again, we're that daily wellness check. So yes, that's how the Lockbox program came about. And it's been wonderful. And even if you have a lockbox on your house that somebody has the code to, we still recommend this one because the fire department has the code. it's a little different. So yeah, we're so grateful for the solution and the opportunity to work with the fire department this way. And it has been a literal lifesaver.
So just let me say, I have one of those alternate lock boxes and they will take the combination and
Good.
use it. And it
Good. But just yes,
benefits me because when I forget my key, I can get it.
yes, but that's the key. You have to make sure the emergency department has the code
Yep.
so that they can still reach you in an emergency. Good job. Good job.
Sheila. Unmute. Yeah.
Thank you. Do you sign up for this through the fire department or?
No, you sign up through us and we do all of the legwork to get it started. And then the fire department is the one who comes out and sets it up.
Okay, thank you.
So is it working a little better once you get the completed application from the prospective client?
There have
Because there
been
were
delays.
months.
There have been delays, yes. And it's going better now. We have just started calling and checking up and that has helped.
Good.
Yes.
Michelle.
So just for the new board members, or you may not know that Meals on Wheels moved into the senior center in 1987. And through all of this time, and I'm kind of going back to the community support that Katie mentioned, but they have been housed at the senior center since 1987 at no charge to Meals on Wheels. It's a part of the city's support of the program. And so they have been a great partner. And in 2013, Meals on Wheels raised money and did an addition on the senior center for over $200,000. And they received a 20-year lease, I believe, in exchange for that sort of partnership that we have. So it's been a long-standing partnership, a really great partnership. And I know when Harold Dominguez, our city manager, came here, he was very intrigued with the relationship that the senior center and the city have with our local nonprofit, Longmont Meals on Wheels. And so in addition to that sort of space sharing, we also share concerns about mutual clients. And so we do referrals back and forth regularly, weekly,
Yes.
probably.
Yes.
And then now, as the city has gotten more involved with the Longmont Housing Authority, 6 of those properties are older adults. Plus, we have about 30% of the people at the suites are also older adults. We just have reconnected, I guess, around that partnership and been working very closely with Meals on Wheels on some very specific situations at those properties. So it's a very strong partnership. Physically, it's really nice to have them in the building, but also in our work together. And Katie, I know you have other partners in the community. You mentioned the fire department, the board of realtors, I know has been really key with the Lockbox program and some others. So it's a very Longmont oriented program. And
yeah, the local hospitals also are a big referral source for that Project Homecoming, because of course that's now the social workers can use it as part of their discharge plan for patients. That's the other.
And just to mention, you don't have to be in the hospital. You can have day surgery and you
Yes.
still qualify for Project Homecoming.
Yes.
I know.
We actually have one other really vital partnership, and that's the Longmont Humane Society, because if a volunteer like Sheila goes out on a delivery and somebody has fallen and does need 911 medical attention, it is heartbreaking how often clients will say, I can't go to the hospital. What would I do with my cat or my dog? And so we actually hold a fund at the Longmont Humane Society where they would transportation kind of depends, but somebody manages to get the animal to the Humane Society, and then they will board the animal during that emergency time until either we can find a family member or an emergency person to come get the animal, or until our mutual client has been released from the hospital.
Janine?
I just want to share a personal experience because I do have a lockbox. I live by myself, and I had an occasion to have to call 911 this past year, and they actually asked me if I had a lockbox.
Oh,
I could get to the door, but it works.
yeah.
You know,
Yeah.
it really works.
Thank you, Janine.
You
And
cover
Ruth,
everything. I'm amazed. I want to move my brother and sister-in-law up here.
Do it. Do it.
Ruth and I had occasion to see the fire department show up here because a Meals on Wheels volunteer called in that they weren't getting a response from a client who had fallen.
Kate, do you know, I have a former colleague who was hired at the Boulder Meals on Wheels development, Shoshina Franitza.
Oh, I have not met her yet. It's been hard with COVID.
Yeah.
I would get to meet my colleagues so much easier before. And now, yes, I'm falling behind on who is new out there. Yeah.
Yeah, she's
I'll have to keep an eye
excellent.
out for her. Okay. You said Shoshana?
Shoshana.
Shoshana. Okay.
Yeah.
Catherine, you're doing a great job on this, and appreciate people like Sheila and others that volunteer. But if a person's interested in volunteering, do you have openings? I always have openings available. I can't imagine serving 450 people.
Tell your friends. Yes, tell your friends.
Just
We
go-
had to do a really intense push once we went back to 5 days a week, because even though our Tuesday, Thursday volunteers, most of them came back, a lot of our older volunteers also kind of use COVID as an assessment tool of pulling back in their own lives and making their lives more simple and safer during a pandemic. And so we did have to do a very big push when we went back to 5 days a week. And we had just gotten to a spot that was really stable, and now the holidays are coming. And we always need extra support during the holidays, as people are traveling, as kids are home from school. And so, we're always looking for those. Yes, and you also need to get ready for school. Put your socks and shoes on. Sorry. As the holidays are coming, yes, we're always looking for those regular weekly volunteers, but we are also looking for long-term substitutes. So if somebody says, I'm only really available for the next few months to substitute, 1 to up to 5 days a week, that's great. We will take them for just a couple months. Now we do have to do background checks on everybody because they are going to the homes of a vulnerable population. So we don't let people just kind of stop in, for once and done kinds of things. But yeah, if they have a couple months to commit to us, we'll take them. And we are also short-staffed in our kitchen right now. And that is a little bit more intense. We do ask our kitchen volunteers to, again, volunteer 1 day a week. But that one is from about 8 in the morning to about 12 or 12:30 1 day a week. So yes, please spread the word.
Thank you.
Thank
And
you, Laura.
Katie, what is the, sorry, I didn't raise my hand.
That's okay.
But what's the time commitment for your regular volunteers that are delivering? Do you need people every week, 1 day a week? Do you need them? Can people do 2 to every other week, or how does that work for you guys?
It is nice for somebody to be able to come 1 day a week, because we can put them in a regular spot, like Sheila's saying, and you get to know the folks on your route. But if you are available as a permanent substitute or even a long-term substitute, then yes, if a couple times a month, as long as you have some regularity to it, since like I said, we do have to pay for background checks. Then what it is, we try to keep the routes to about an hour to an hour and a half. Again, so somebody could potentially even do it on their lunch break. You show up at the senior center at your designated time, which is anywhere between 10:30 and 11:30. You just we have your route packed up for you these days because of the pandemic, but we do ask that you double check to make sure that all the counts are correct so that it's more efficient, so you don't have to come back, especially if you are in a tight crunch. So you can make sure, double check our work, and then you go out on your route, and you can, it's nice if you can return the delivery bags that day, or you can bring them back the next time, you volunteer. or you can pack them in your own delivery bags if you have a cooler in your car that can maintain the temperature of the food so that the last person on the route is still getting a serve safe temperatured food as of, just like the first person on the route. You can repack it in your own stuff and be on your way and then not even have to come back to the senior center and drop off the bags.
Gotcha. All right.
Any other questions? Or do we let Katie resume her role as mom?
Yeah. Late starts, throw everything off.
Well, thank you, Kate. Oh, Sheila.
Yeah, I just want to say to Katie, I've enjoyed my time doing it, and will continue to do it. But thank you very much for the background to
Thank you. Thank you.
Meals on Wheels.
Thank you
It's,
very
it's made a
much. Yeah.
difference. So
Yes, and I will send Michelle our results from our survey as well.
Great.
Thank
Thank
you
you,
very
Katie.
much, Katie.
Thank you all.
So we're back to finishing up old business. Does anybody have anything to add on old business? Other? Or we can move on to new business, which is responding to Carmen's question, equity and inclusion.
So this was something you all got with your minutes, the PowerPoint from Carmen from last month. And her question to you all was, what would be helpful to boards and commissions regarding equity and to bring more inclusivity to the board? And so I just want to touch base with the board. Do you want to talk about this today? Do you want to put it on another agenda? Do you want to discuss for those who were not at the board meeting a little bit? But I think Carmen is sort of managing our work as a city going forward regarding equity. And she is really looking for some specifics around boards and commissions, equity and inclusivity. So do you want to tackle it today? Do you want to table it to another board meeting? I just wasn't sure how to put this back on your agenda or not.
I have to confess that I just skipped through all the slides in the information you sent, and I still appreciated what Carmen was doing and is doing, but I didn't pay any attention to her request. So I would say I would like to think about it more and discuss it at a later meeting.
So maybe we can, Prudence?
So is Carmen looking, just to clarify, because I wasn't at the meeting and I could look at slides, but just to clarify. So Carmen is asking the advisory council how to become more inclusive of
Minorities?
Well, majority people, whether that be
Yeah.
Hispanic, Asian, gay, whatever that is that what she's asking?
Mhm.
So I think she's asking what can her role, the role of the work she's going to be moving forward, which she does have some additional staff going into 2022. How can she and their work and me, I mean, how can we better support equity and inclusivity on boards and commissions? Because we know there are boards and commissions that do not equitably reflect the members of our community.
Okay, so one of the things is that, you know, how they advertise for boards such as this, because it's either in the Longmont Times Call, that's where I just read, I think it was yesterday, there's a whole bunch that are open. So I think kind of there's kind of two, to me, you have to read the Longmont Times call to know about. That's number one. So I think there has to be another messaging platform, whatever that should be. I don't know, that's up for Carmen to decide. The other thing is that they, even in that description, they don't really tell you what the advisory councils do specifically and how much time commitment there is. And I think, you know, for people who work, because some of the advisory councils probably meet at night. For people who work, it's not good during the day, you know, so I think there needs to be more of a description on what they do and what their limits are. And what I think the third thing is, what is the value to the community of being on an advisory council? That I think is not really spelled out. And I think for Carmen, she would need to go to specific groups and have that information in order to be more inclusive of everyone. Because, I mean, I joined because I had an interest, I read, but, you know, I kind of didn't know what I was getting into. So
Thank you for saying yes.
I do think that there has to be more of, in order to be inclusive, I think you need more of a personal touch than these are the councils, these are the openings. This is what you do. And then Carmen would need to narrow it down to, for the group, whatever that group may be. So, you know, I'll make like, you know, let's say, I think there's one on architecture or something. Is that true? I can't even remember the name of the thing. You know, does that appeal to a certain subgroup rather than the senior advisory council? So, you know, I think it has to have more specificity.
Yes, I agree.
It sounds like they need to rewrite what they're about, and perhaps, just as an example, put something to the effect, your voice matters on next door, and a link to the city explaining what you've just requested that they explain.
Right, I think it's difficult.
Yes.
Very.
I also think it's important that we actually go to the community to allow them to know that, one, they're wanted, and that their participation is going to make a difference. And, you know, whether it's LGBT, whether it's the Native American community, whether it's the Hispanic community, that an effort is made to actually go to them instead of expecting that they're going to read something online or in the paper and automatically respond to that because they have good reason not to trust that. So I think it's that step might be a very important entryway to inclusivity.
Mhm.
You know, I wonder if, you know, there's some way to either send out a letter to everyone in the community, you know, at an address in our community, or if there is some sort of poster that is put up at, you know, municipal buildings, at the senior center, at the post office, you know, places that people frequent, so that they can actually see those. And it doesn't necessarily, the posters don't necessarily need to go into complete in-depth, but like Susan said, announcing to them that you are wanted, you're wanted in our, to help grow our community and direct where our community is going, right?
I also think, one of the things is people like to see results. So
Mhm.
if, I know, Julie's saying yes. So, if in their kind of blurb or however you want to say it, they could say, the historic, I think there's one for historic stuff. If you look on the east side, there's now plaques in front of everyone's buildings, so I think it's an ask as well as this is what was accomplished. So even for the senior advisory committee, here's the ask. This is what you do. This was the result. We have a new program for feet, whatever that is. And it doesn't have to be 7 paragraphs. It could be a blurb. So I think, people do like to see, well, are these advisory councils just blah, blah? Or are they really, will my voice be heard on certain, not all, but on certain things?
Or look at the most recent surveys that have had good results in getting feedback and getting people engaged. So I don't know what you call a great result, but there was the Envision Longmont, the library did a survey. I mean, we want to know what you want, and then you can be a part of it.
Right. Yeah, I think it's more of an ask.
Like with a bike path, I still don't know if you can go from west to east the whole way.
I have no idea myself.
So we need
Marcia
to
might
know
know the
that if you
answer to
want to be
that.
on that
She's-
board.
Marcia,
Yeah, so I would like to just interject that while some of the Envision Longmont surveys, the Engage Longmont surveys have had pretty good numeric results, that they haven't had such good results in terms of inclusivity. So that, the more marginalized communities have had poorer response than the general, and therefore I think we need to look at other ways of engaging.
and I do think at this point, that's where the person-to-person contact is important, where you sit down and talk to somebody over coffee or on a park bench.
Yeah.
Right.
Like Susan, who can sell ice to Eskimos.
So I took a lot of notes and I will share those with Carmen. And I'm sure Prudence also has notes, but I will collect them up and give those to Carmen. And I think Sheila and others who may want another month or so to just kind of ruminate on it, we can continue to give Carmen ideas about this. And I think you'll hear more as she pulls the team and the work together. I know she's got some council directives that she needs to be responding to, and really great ideas. I very much appreciate, and I'm sure we'll keep talking.
Michelle, the city line with our water bills had a nice, it was at least in there that they were looking for that. And I found that, I thought that was helpful, especially when I talked to the Latino Coalition about it. I don't know if anybody's responded or not, but the thing is, it's nice having it on there and any other, information that goes out. I agree with what's been presented about a specific person to call, because here it's a general number, and then it has a website. And like I've said earlier, I know good and well there's a lot of seniors that don't have ways of getting a hold of them electronically, but still the thing is, at least those that may be wanted, that are aware of it anyway, let's put it that way. So I think that was a good thing. And of
So quick
course, I'm sure Carmen's on at least Spanish radio stations and other things too, but that was one of the other things.
So quick question before Marcia. that insert that you have, are Spanish-speaking people able to get that in Spanish?
Yes, it
Okay.
goes out in Spanish and English to my knowledge.
Okay.
Mhm.
Marcia?
The other thing that I was going to say was that in terms of maybe facilitation, this meeting is the hardest because there is the presumption that you're retired and that therefore you can do a meeting in the middle of the day. But even the evening ones, people for participation may need childcare, may need transportation because they're either a 0 car or a 1 car family and they need to keep the car where the children are. There's a lot of things like that are barriers that may need to be considered.
Mm-hmm. Good point.
And if we're serious about it, we should be serious enough to do something about eliminating the barriers.
So should we move on to other new business? Does anybody have anything they'd like to bring up?
I have an experience and a question for anybody on the board. Transportation issues continue to be a major problem for our community. And working in the resource center yesterday, we had 2 calls from seniors that are unable to get transportation, for medical procedures. They have to have somebody take them and somebody pick them up and take them home after the procedure, and potentially even stay with them for a couple of hours. And also people that can't take via to a doctor's appointment, if the doctor's appointment is like in Firestone. So I'm wondering if anyone on the board has other resources for us to explore as potential modes of transportation for people that are having lab test procedures or even doctor's appointments outside of the immediate area. I had no idea that VIA would not go to Firestone, but they don't. So if anyone has any other resources that I might call and check with, I would appreciate that feedback.
Prudence?
Let's go to Michelle first.
Okay.
So Janine and I have some, and there's generally a higher price tag to those options, but we have used our grant resource money to help pay for those circumstances. So I can talk to you about it and make sure Amy and Veronica and Melissa have that as well.
Yeah, it's not so much about payment or money, Michelle. It's more about finding the access, finding the person that can go, can wait, can pick up, can support in that way.
Right. So some of the home care agencies will do that, but you're going to pay $30 to $40 an hour for that.
Okay.
But we can help with that if it's a barrier.
Okay. Yeah, we need that information.
What I was going to say, because Boulder County got all this money, is that what some health plans, I happen to know this, have done is they are paying for the client to use an Uber. And
Uber will not, they can't go by cab or Uber or anything like that. They have to have a person-to-person for procedures.
oh, right.
Yeah, the medical appointment perhaps, but it has to be a person and a car and somebody that will commit to that time frame.
Yeah. The procedure one is really a tough one. Like if you're getting, a colonoscopy, someone has to
Right.
drop you off, say you're going to be there, and then they have to pick you up. You know, I don't know whether that's a volunteer opportunity for someone
Yeah.
through either the senior center, or I don't know about Thrive, or the Mormon Church. You know, because you know, specifically like colonoscopy, you know, everybody's going who's over 65. And someone has to be there. It's not like they could Uber. They could Uber there.
Right.
Someone has to pick them up.
And preferably be
yeah.
with them, and there's a medical legal part of that too. It's got to be an organization that has, God forbid, anything would happen, but some coverage for the what ifs.
The liability.
Yeah.
You know, they're usually getting for said, so they should be fine theoretically.
Well, not, no.
No, not, right? So I think
Well,
that's a volunteer opportunity that maybe we can explore through some kind of partnership with someone.
Just as a driver for Cultivate, it's a little murky because
Mhm.
there are facilities that will allow us to drive and take the person home. And there are other facilities that will not.
so Susan, what is the will not? They actually require it to be friends or family, or?
The will not is, we are not allowed to sign paperwork that we are responsible for the patient. Although we get them to the appointment, we put them in the car, we take them home and make sure they get in the door. So
Mhm.
that's up to the facility to decide. Rock Creek, I'm taking somebody next week. They'll allow a Cultivate volunteer to do that. There's a facility on South Main Street by McDonald's. They will allow that. The endoscopy center in Boulder, they want nothing to do with a volunteer. And it's
Huh.
really hard if there's no friend or family, really
Mhm.
hard.
Oh, I'm in that position, and I mean, fortunately, I have had friends that would do it, but it takes half your day.
Yes,
Yeah.
it does.
And they work, and
Mhm.
family members work, so it requires a day off. It's just something that would be nice for us to think about a need at, and all input is welcome.
So
Marcia.
this is a question. 3 years ago, I brought up before the council, and it passed as direction to staff and didn't get executed very thoroughly, I thought, that we should look at broadening our means of transportation. And the only thing that came out of that was that we did get an improvement in our VIA contract, to the extent that they got same-day reservations and stuff. And that was a big deal, but it was not nearly as much as I hoped for. And in this discussion, what I'm seeing is, well, if it's going to be volunteers, or if it's going to be paid, like an Uber or something, where somebody's being paid to do it, then to get the commercial organization that's doing it willing and on board, there needs to be some sort of an indemnification. And that could be done by the city, or by the senior center, or by some organization that's reliable. So what does everybody think? Would that be something statutory that we could do, that we could put together a program? There probably is money to be found, although I understand that for the ARA grant money, there were $13 million worth of grants and $60 million worth of requests from the staff. So
I suspect that the liability issue is part of the resistance for some of the medical facilities in releasing people without, to somebody that may
Mhm.
not be liable.
Yeah.
And so I think that would help, Marcia, actually, that it's a very good thought.
That's what I'm hoping, and the relative liability versus the size of the city, for example, doesn't seem like it would be too big of a risk. It's a big risk if it's your personal insurance.
Right, right.
Sheila?
I'm just thinking, excuse me. I'm just thinking about individual Uber drivers and taxi drivers, however much however much liability insurance, to call it that, is, how many of them really want to pick up an old lady at a hospital and drive her across town and go home.
Mhm.
I think there's rather too, when you're dealing with it commercially, I think there are rather too many objections, and yeah, I'm just thinking it through in my brain, and I hate to be negative about it, but I'm going to
No,
be
you're
negative
right.
about it.
It's like background checks, right? We
Mhm.
Oh,
carry kids around unless they've had background checks.
yes.
Well, usually the relationship between an organization and Uber or taxi is contractual. So it's a contractual relationship rather than me just calling an Uber. So if the city wanted to do that, what happens with either the taxi service or the Uber driver is that that's a contractual relationship. And in the contract, I work for a health plan in California, the members get Uber, but that is a contractual relationship, and they wait for the member, they do everything because there's a contract that pays them a certain amount of money for these certain services. I'm also wondering whether Marcia has the city looked at a transportation broker who brokers it's like a real estate broker. They have transportation brokers that line up the transportation according to need.
Prudence, until you said it, I didn't know that was a thing. So that's a great idea, as well as, and you're something of an expert about insurance programs and stuff, aren't you? So could you give me the information about the insurance program in California that you had that covered this sort of thing?
Yes,
And
I will try and get that for you.
research it.
Mhm.
So those two things could get me started on making, a passable motion that might turn into a city program. That would help a lot. Thank you.
Anybody else? Moving on to reports. Supervisor.
So just a couple of things. We do have our first extended trip gone since the pandemic started. We have a small group that is in bluegrass country in Kentucky. So Teresa Schulte is escorting that trip, and no news is good news, right? So everybody is off and enjoying the bluegrass country there. The park will host Longmont Lights again on December 10th. We will not be doing a concert or anything like that night. What we are going to do, and again, this is COVID dependent, is we will have Santa Claus inside the senior center gym. We're going to open up to the dining room so we can do as much distancing. And we'll, of course, it's all subject to change, but that will be the activity that's occurring at the senior center for Longmont Lights on Friday, December 10th. And then December 11th will be the holiday parade again. So that's, of course, all outdoors and in Roosevelt Park. But the lights are up in the park and they are scheduled to get turned on November 19th when the ice rink opens back up. So it's actually one of my favorite things is when the park is all lit up and it snows. I just absolutely, it's just a beautiful setting and I do love this park. We have a concert this Friday. It's our first concert in almost a year and a half. And we have a group affiliated with CU. I think we have about 70 people signed up. And so the Friends are sponsoring that cultural enrichment program. We're very excited to see how that goes. We are working on the Friends for the 2022 budget. And we are looking at increasing the gift to the city for operational dollars from $40,000 to $50,000. So that is really great. We also are looking at increasing the wellness dollars. Probably up to about 5,000. And the focus of that increase will be around fall prevention and really trying to look at some unique ways of bringing in physical therapists, occupational therapists, et cetera, and really doing some focus on those, that sort of area of wellness, fall prevention. Scheduled at this point to go to City Council on November 30th with 2 grants. One is $15,000. I wrote a very small grant to Next 50 to purchase fire stops for the Longmont Housing Authority properties, senior properties. The other hat Marcia and her colleagues wear, but the funds would actually come to the city. So Marcia gets to put her city hat on, not her LHA hat, to consider that grant. And then the other grant is $45,000 from Boulder County Area Agency on Aging for direct assistance. So we ran those funds through the Friends of the Senior Center historically, and they were on a as needed kind of basis. So somebody needed $1,000 for hearing aids, the staff could ask the county to support that. We kind of changed that all up and we actually asked for a dollar amount. We asked for $35,000 in direct assistance to older adults, and we asked for another $10,000 for assistance to caregivers of older adults of any age, caregivers of any age. And so this will be council's opportunity to accept or reject those funds. And we are doing it differently. Those funds will no longer go through the Friends. So the Friends have their last resort money, which is about $25,000. This year we had $8,000 additionally from the Sunshine Club, specifically for dental care. That went through the Friends of the Senior Center. And then we have this memorandum agreement between the city and Boulder County Area Agency on Aging and a $45,000 in direct assistance. So that's fabulous. It's a great a pot of funds, and we have the opportunity to increase it as we demonstrate need. So that will be on City Council on the 30th. Sounds like it's a very full agenda, and we may have new council members. So I know we'll have a new mayor. Not sure where that's going just yet. I went online early this morning, but that was about 6 o'clock. So I'm not sure where we are. So those are some of the things we have coming up and moving forward. We are very excited to start talking with Front Range Community College about some opportunities for use of some of their classrooms that utilize different technology. So we are finding more and more, we don't need that classroom that had 15 to 20 computers. What we need is a more learning teaching environment without computers, because people more and more have their own devices. So we're getting ready to just have some great conversations, I think, with Front Range. We've had a very good partnership over the years, so excited about that. In terms of technology, we had asked for another 50 Chromebooks from Boulder County Area Agency on Aging. I think right now we have about 10 left. And so we are reaching out to all the senior housing properties as a means of trying to let folks know that these Chromebooks are available. Chromebooks are not for everyone, and the Friends did provide some funding for some tablets if folks preferred tablets to Chromebook. And so we are trying to work with folks and get them connected through the Friends, through the county, and that's been going well. And the county has paid for, they've contracted with an individual. She will go into homes, work with people directly up to 3 visits to try and get them connected and using their new device. So that's been really great too. I already did the position update. We will be hiring, hopefully, a new counselor after the first of the year. I'll be coming back to the board about that. So super excited for that. Melinda Saracillo is our resource specialist, new to our team. She's working with Amy, Veronica, and Melissa. However, she's housed at the Suites Supportive Housing and at the 2 senior properties, the Lodge and the Hearthstone. And so she's been on board about a month, and it's just been great having her. She is doing really good work and great case management at those properties. And so that's been good. I think that's it for me.
Okay, Marcia's up.
Well, let's see. I think that I've been putting my oar in already about things that are, I hope, will be on the agenda for the next council. The Longmont Economic Development Partnerships Advanced Longmont 2.0 program has a connectivity focus, and these are longer term things. You know, making a contract with a liability protection with Uber, for example, is something that could be done within the year. But you know, changing the frequency of our public transportation or the contract with the public, that is going to be a longer term thing. But I do think that we do have a big focus on access to transportation that is going to be one of the things with that the new council will make as an objective. Obviously, a big deal is going to be affirming the long-term the long-term objectives that the previous councils have already set. That has to be done. Otherwise, I am taking requests because access is the, you know, is the big deal that you know we have on our plates. And I know if Dr. Waters is mayor, he is also very interested in reforming the recruiting mechanisms for the boards and commissions. So, you know, of the things that we've talked about today, I am hoping that both of those will be, regardless of who is mayor, I'm hoping that those will be on the agenda, because you know, we've got so many big changes facing the city in the next decade that it is going to be much harder if we don't immediately get to work making ourselves more inclusive than we are, because otherwise it'll be really hard to bring everybody along with the changes, and it'll cause a lot of division.
Thank
Any
you.
questions for that? Oh, and there will be at least one all-new council member. The math doesn't work any other way. Prudence, you're muted. I think you were
Yeah,
talking.
who is that?
Well, we don't know yet. So the mayor's race is still very close. Tim Waters is up by 125 votes. And I think Aaron is clear to be reelected, but Chiquita and Sean are so close that we won't know, which of those two have won anyway, either. But Polly Christensen is term limited, and Brian's not running again. So that means there's no way to work it. Both of the mayoral candidates that have a chance are going to be vacating a seat, so that seat will be open, and that means at least one person who hasn't sat on council before, unless Sean McCoy wins. And because even though he's not on the most recent council, he did sit on a previous council.
So is there a recount rule?
Yes, but it is 1/2 of 1%. So that, I think I figured out that would be around 30 votes. It is really low this year, apparently. So according to Don Quintana, who has been following this precinct by precinct, which I think nobody else has any access to that level of data right now. But she thinks that the leads are probably set. And that the turnout is really low this year.
Yeah.
When do
Yeah,
they
it's not-
expect to have the tallies set?
Well, there's two answers to that question. Dawn believes that the reason they have elected to not give an intermediate update today, but the next update is expected at 6 p.m. this evening, is because they think that they will have counted all the votes by then, and will be able to make a more definitive announcement. So that's one thing. The other thing is that the election results are expected to be certified by December 6th. Now, the council has always proceeded prior to the certification of the next election. I'm sorry, yeah, by November 6th. So, but the council has always proceeded anyway. So, those are the two definitive dates.
Thank you.
There is an organizational meeting of the council this coming Monday, and the first regular council meeting is the Tuesday following.
Okay. Janine?
AAA does not meet in November, so I have nothing to report today.
Okay. And the Friends, I'm gonna call on Michelle, because I wasn't able at the last minute to make the meeting.
Yeah, I pretty much covered most of that. The only exception is there is potentially an open seat on the Friends board. If you have someone you know who might be interested, why don't you let me know, shoot me an email. They have one name for that empty term, and don't know if that person's going to say yes or no. So it'd be a maybe, but, and then I think the budget is the other thing, which I already covered.
Okay. Art? You're muted.
Some unknown reason, we had very few people attend our last meeting, but I did talk to them about the position, the custodial positions, hoping that they might have somebody that might apply. So we talked a little bit about that. Also talked to them about applying for the Friends and Senior Board. And again, I don't know if anyone is applying, because most of those people that are on those boards are the same people that are on several other boards. So that's what makes it difficult. Let's see here. Oh, one of the people that did attend just brought up something about there's a little form that they've actually sent out or are distributing. It's called Avoid Utility Shutoffs. And I thought it was kind of interesting is that says that 19 days after something's over, your utilities are overdue, a warning letter sent out and telling you to call or visit for a payment plan options. At 27 days overdue, a shutoff notice is sent out. And at 37 days overdue, utilities are actually cut off, and you end up with not only catching up on your bill, but you have a $58 shutoff fee that you have to pay also. So what they are encouraging is that if you know of anybody who just cannot pay it, of course, fortunately, we have the Friends Board, but the city, I guess, is working with that also. And they're willing to help people if they can come up with some kind of a pay plan. And they also said that there are some scholarships that are available. But I thought that was kind of interesting that they brought this up on that. Let's see, the other thing I just want to bring up, and we were talking about Carmen and getting people on the board, et cetera. One of the things that happened is my computer kind of froze up that day, so I had printed out a copy of my application to be on the what do you call it, to renew my additional term. And when I took it down there, they said they couldn't take it. It has to be online. So again, that's another thing that might be brought up to Carmen is that people may be able to fill them out and take them in person rather than having to filling out online. Let's see, I think that was all. Yeah, I think that was all that I've done. One of the things I want to ask of Marcia, and I'm sure it's not committed, but they're going to be the people that are reapplying or are applying for those boards. I guess are going to be done on December the 4th, and I'm going to be out of town. But what's the gal's name down there at the city that I turn these into?
Don Quintana?
No, the other one.
Yeah.
In the city manager's office.
Lucien?
I don't know. No, that's not her either.
Maria Tostado. Usually Dawn who manages
But
the
anyway,
board. She's the city clerk.
I told her I was going to be out of town, and if there was anything that I could do to whatever, and she says, well, send in your application and saying you're going to be out of town, they'll work something out for you. But I just wanted to let you know that I'd like to go ahead and serve another term on the Friends Board, on the senior board. But again, I will be.
Yeah, that's especially when you're a returning member, so that you have a track record to run on, sort of. Yeah, she always makes a special accommodations for people who are unable to make that date and let her know in advance. So you've already done the right thing. Just note it on your application again, so she doesn't forget. This is something that I could have brought up as a council issue, but Art reminded me of with this how to avoid cutoffs. The new advanced metering system that the city will be rolling out this year, I hope should have the capability to let people make plans to avoid cutoffs. So it's called prepay sometimes. And people can get notified if they're about to use up what they've prepaid for, and can avoid a shut off by, doing things like turning down their thermostat proactively, right? Because, even if you're an elder, it's still preferable to have to wear a sweater inside the house all the time than it is to get your electricity cut off. And so I'd be very interested in us in assessing, and maybe this organization could do an assessment or propose an assessment among the senior population about how interested they would be in that, because of all of the new features the new system is going to allow us to deploy, they're going to have to be prioritized. And so, it matters whether we get prepay in a year or prepay in 3 years. And that's something that the council could influence. So I would appreciate your feedback on that, or appreciate a plan for assessing it. That would be really helpful.
And Janine, we're back to you.
I do not have anything to report on LEDP. Sustainability is next week, and I think Dave is planning on attending that.
Ooh, that might mean that they've picked a vendor. I hope so.
And then the final committee here is engaging caring communities. Janine wasn't able to attend, as I remember, so we have one more meeting. That October 1 was not the last one, but the crew is talking about being able to begin rolling out a program in Longmont in December. And the idea is you sign up, or the person, whoever, a Longmont resident signs up. Maybe it involves a caregiver for the person, but supposedly they'll only have to put the information in once. It can be shared, like if you're doing Meals on Wheels and also the R Center, people can share the information, but the person or their advocate actually controls who will see the information and what they can see. We also talked about incorporating a feature called Break the Glass, like you do with in a fire emergency, so that if somebody needs access, they're trying to build this into a computer type situation. We'll see, keep your eyes and ears open to see how it's rolled out. Yes, Prudence.
Just to let you know, Epic Systems, which is the EHR for anyone who has the right system, they have something called Break the Glass.
Yep.
And there's a warning saying, you are breaking the glass, or if you break the glass and you're not supposed to, so you're not the relative, there is a warning. So break the glass is if they're using Epic, is very common.
Yeah. They're actually writing their own software, and they're calling the information that the person or the advocate puts in, it's going to be called like a digital passport, a community passport. So, and they're controlling who sees what information. But it's so much, it sounds great. Pay attention. Let's see, how it works.
We have one more meeting. I believe it's next week.
Yes.
And so if anybody has any specific questions, please email me or Susan, and
Yep.
we can address that with the group.
So in light of today's conversation, I think we should bring up to them the importance of transportation for so many. That could be another piece that possibly they could incorporate. So. Any other questions, comments? Aha, it's the manager again.
No, a question to the board. So we had talked at the last meeting about inviting the new public safety director to a board meeting. And I know that he's got lots on his plate. And so what I was thinking is that perhaps at the December meeting, you all could spend some time maybe thinking about your questions, your topics, etc. When I send him the invitation, we could kind of give him a little heads up about that and just be flexible about, whether he can come or not come. And maybe it's a February or March kind of thing. So does that sound like a plan for folks? We'll just put that on the December agenda. Okay,
That's fine.
great. Okay, thank you.
Any other comments, questions? Sheila?
It occurred to me over the last few weeks, we had discussed at some point in the past whether board members should have official or city email addresses. And I'm wondering about the exchange of emails between, say, Marcia or Michelle or any of us about what could be called city business, using personal emails, whether that's could present any issues, or whether setting everybody up with an email, official email, is just not worth the trouble. No, Marcia, I know you've got some thoughts about this.
Well, there are several answers as usual. None of the other boards have that.
Okay.
And if you're exchanging emails either with a member of the city staff or a member of council, then the email gets archived regardless of whether where you're sending it from or receiving it. So the only potential exposure would be if you are the board is emailing among itself. And there are, again, two answers there. One is it would be prudent of you to not delete those emails, but put them in a folder somewhere. But it's also a good reason for me to ask. So I will do that.
Okay. Thank you.
Motion to adjourn, if nothing else.
I second.
Art, motion, Janine seconded. So thank you, everybody.
Bye, everyone.
Thank
See you
you.
next month.
Bye, everyone. It's nice to
Bye.
see you.
Marcia,
Yes.
I have a question as, so people who are in Medicare Advantage plans usually have a transportation benefit. And I know I'm in one, and I just had to read my annual notice of change, and I get 12 free round trip visits for medical appointments and stuff like that.
Wow. Who's your provider?
Kaiser.
Really?
Wow.
That must mean I have them too, and I don't know.
And me.
Exactly.
So who's the transporter?
Yeah, so they have some kind of agreement, and I don't, I've had a friend use them, and I'll have to ask her, but they were excellent. So she said they came and picked her up on time, they waited for her, and then they brought her back home. And she
Yeah.
had low
Bring
vision.
that information to the next meeting.
Yeah, so, and also, United Healthcare has it. So, but
Oh.
if you have a regional Medicare, you do not have that benefit, unfortunately. So some people may be in some kind of managed care plan and not know they have the benefit.
I didn't know.
I
Yeah.
didn't know.
Yeah, so whether you have core, silver, or gold, I don't know what you have.
Yeah.
And you can also, this is interesting because I just have my annual notice of change, is that if you're a Kaiser member, you could also, I'm in silver, you can purchase additional optional benefits which increase your transportation benefit. So there is that's one of the things, and I feel for people who are in original Medicare who don't have the access to different services. It's kind of sad.
Well, that is something else because, my healthcare needs are not that great, bless me. But so I ended up this time opting for the 0 premium Kaiser Advantage program.
Mhm.
And so I don't know, I mean, I don't necessarily have gold or silver benefits, but you do get more benefits with even that. And there's kind of no reason for anybody to be in unadorned Medicare when there's a 0 benefit option, right?
Yeah, but that's, people have their reasons, and I'm a Medicare counselor, so I've heard them all.
Okay.
And, sometimes they're like, oh, I want to keep my doctor. Well, how old is your doctor? 75. I said, don't you think they're going to retire? I just was reading, I think it was Monday, 55% of Medicare members in the United States are in managed care plans. And Medicare Advantage plans. So it's just increasing exponentially because the benefits, whether you're in United Healthcare, Aetna, or whatever, are really quite high. I mean,
yes.
Yeah. So now there's an I have an over-the-counter benefit, and I also have a monthly, every 3 months, quarterly or something, $80 benefit. So, and I have hearing aid benefits and stuff like that, dental. So it's unfortunate. So, one of the things is that many of them are providing transportation. Many of them, Aetna, all of them.
That is a good thing to know.
Yeah.
I mean, it would be, I don't know whether we would have an intern or whether, because we don't have a health department, or maybe it would be a good thing to have Boulder County Health look into, or to suggest, we don't get to give them orders. But just the idea that people don't pay close attention to those really peripheral benefits. And certainly before I would suggest some program like that out of the city, we should make sure how widespread it is.
Yeah, I have the 2022 managed Medicare Advantage list and what benefits are offered, and I can send that via email.
Oh, that'd be wonderful.
Oh, yeah.
Because I'm a counselor, so I have it.
Yeah, you're so useful, Prudence.
Yeah.
Yes, you are.
Like,
Don't go anywhere.
Phone number.
yeah. The second thing, and this is a personal question, I'm at 641 Kenmore Court. I have no idea who my council person is.
Put that in the email and I'll turn you right around.
Okay, thank you.
And the other thing is if you Google from a Longmont, any Longmont address, if you Google Ward 1, Ward 2, Ward 3, then you get a map.
And that map is almost impossible. You know, I'm not a map reader. I have to say it's a real-
Okay.
I've lost people on trails when I've been hiking in the Sierra Club. So maps are not my specialty at all.
Okay. Put your address in the email you send me with the benefit information, and I will come right back with who your ward representative is.
Great, thank you very much.
You're welcome.
Prudence, can I ask you a crazy question?
Of course.
Because since obviously I'm not on Medicare or any of that at this point, I'm wondering for my mom's sake, she's in Washington State. Are the Medicare programs the same throughout the country?
No, they're not. So
Okay,
they are not. So
okay,
you should be able to go on. I'll look around for you for Washington State because they should have they should have Medicare counseling because every
okay,
state, every county, district, whatever you want to call them, has Medicare counseling. It's called the SHIP program. It may be different in different states. And you could actually talk to a SHIP counselor, and we are doing it remotely on Microsoft Teams.
okay, all right, yeah, because I'd like to try and find out what benefits my mother has, because I don't think that you guys are talking about dental, and I don't think she's aware that she might have dental coverage, and she really needs some
Yeah.
stuff done.
I mean, I only have $2,000, but that's more than when I was an employee. So,
Right.
you know, cleaning and stuff, all that is taken care of. But
Yeah.
implants wouldn't be, but I'm thinking Costa Rica if I need one.
I'm with you.
Right, like, you know,
Right.
get it cheaper overseas and have a good vacation.
Thanks, everybody.
Yeah.
Thanks.
All right.
Bye,
Have a
folks.
good one.
Bye-bye.
Bye-bye.